If you or your loved one finds yourself in and out of the hospital, make sure you watch this video. What I'm about to tell you could save a life. I am a board certified family medicine physician, and I've also sat in the waiting rooms. I've sat in the hospital rooms with my family members, not knowing what was going to happen and what was going on. So I'm giving you the insider knowledge that a lot of families never actually get. Now let's talk about the problem. A lot of times there are communication issues within families. There are communication issues in between the doctors, nurses, and the patients. Sometimes we don't mean to as healthcare providers, but we end up using some type of medical jargon, and it's really a communication breakdown. We can fix that. So, the first things first, if you find yourself in a situation where you're sick and you don't know what's going on, ask the healthcare provider, hey, what is your working diagnosis? And what is it that you think is going on with my illness? This is something that you deserve to know. And if it changes, which it possibly could, then feel free to ask again. One of the other things that you have to think about is medications that you're taking. Now, medication discrepancies can occur in hospital admissions. So it's important that your loved ones and you keep a medication list. Make sure that if you are taking any medications, you keep that list active. Talk to your parents, talk to your family members about it. Another thing, be present during the rounds in the morning. Designate at least one family spokesperson or one person who's going to be with the loved one, and that is actually going to be able to remember what's going on when the doctors come by. A lot of times this happens really early in the morning, but it is important to try and be there during rounds and make sure that the family spokesperson has left their contact information, and make sure that you're able to communicate. If there are any issues, you could always ask, hey, what time are the doctors going to stop by? Or what time do they usually stop by? And then once a patient is getting ready to get discharged, this can also be one of the main issues that, if it's not done properly, it could cause readmission. So it's important to ask before you leave the office, before you leave the hospital, what's the diagnosis? When should we follow up? When should we come back? And has any of the daily medications changed? A lot of this stuff is going to be in a document. Sometimes they call it the after visit summary for inpatient, and then sometimes you get your hospital documents. But research shows that your loved one's own doctor frequently doesn't receive the discharge summary before their follow-up visits. So you might be the one who can help facilitate this. You might be one of the people who can just ask, hey, where's the paperwork that my loved one is getting discharged with? The most important thing is making sure that you speak up. You don't have to be rude when you have questions for the medical staff. It is important to stay engaged when it comes to your health, when it comes to your loved one's health, and dealing with the healthcare system. The families who advocate loudly, they get better outcomes, and that is in the data. Nobody gives us a guide when we have to go to the hospital, when our loved ones have to get admitted to the hospital. So that's why I'm here. Make sure you save this video, share it with someone who needs it, and follow me, subscribe to my channel, because there's so much more that you deserve to know.